Hi, I'm Dr. Melissa Miskell. Welcome to this masterclass on hormone replacement or bioidentical hormone replacement. I am a gynecologist and have been in private practice for 25 years, and I have been doing hormone replacement for about 22 of those years. So I'm very excited to share my knowledge and experience with you, and I hope you enjoy this masterclass. Some of the most common symptoms that women would have when they start to go into perimenopause and then menopause is going to be things like hot flashes, vaginal dryness, mood swings, low libido, lack of interest in sex, a inability to sleep well, fatigue the majority of the time. Men have some of those same symptoms as well, especially the fatigue and the lack of sex or the lack of libido. So, if you're just becoming interested in hormone replacement, you probably will have at least two different main topics that will be thrown at you. One of them is traditional hormone replacement, which is usually Premarin and Provera, which are synthetic estrogen and progesterone. The other would be bioidentical hormones, which would consist of estrogen, progesterone, and typically testosterone. So these bioidentical hormones are actually made plant-based, but in a laboratory. So you have to make sure that you understand exactly what you're reading. So synthetic hormones, Premarin and Provera, made in a laboratory, but they are not the exact chemical structure, chemical compound of what our bodies make. So they are not estrogen, progesterone, testosterone specifically. So estrogen in making a bioidentical hormone, also made in a laboratory, but it is the exact chemical structure of the estrogen that we make as women, progesterone, testosterone, the same way. So that's why they are called bioidentical hormones, because they are the exact chemical structure as what our bodies produce. The typical myth that we hear is that estrogen causes breast cancer. And this is false. There are many, many studies that show that estrogen actually will be protective against breast cancer. So, the Women's Health Initiative trial that came out 25 years ago started this bad science that women have been told for years and years. This trial has been refuted numerous times in many, many studies. So that really is the number one myth that we hear as providers, that estrogen causes cancer, breast cancer specifically, and this is just not true. So here at Hormones by Design, our optimal way to treat women with symptoms of hormone replacement is with an injection. And so we design an injection individually for each person because everyone is different. Everyone's lab values are different. Everyone's symptoms are different and more severe or less severe in certain cases. So typically, the way we go about addressing these at Hormones by Design is by drawing your blood, and you would have your blood drawn before you would see a provider. So that provider already knows what your levels are. And then we'll discuss your symptoms, what's important to you, and we'll design a hormone injection that has estrogen and testosterone typically. That is exactly the injection that you need to relieve your symptoms. Once we've done that, then the injection lasts for a month. You'll come back in 4 weeks, having had your blood drawn again. And from there, we can adjust the injection to fit your symptoms and also judge off your lab work where your actual numbers are. So everybody's numbers fit them differently. So someone might do really well with a high estrogen. Some people might not feel that great. So it's all about a conversation with your provider that gives you an exact hormone replacement that fits your body. So the determination of what your dose would be for a hormone injection comes really from a conversation with your provider and what your labs are and what your symptoms are. And so we can adjust the dose of the estrogen and testosterone accordingly and go off of your labs somewhat, but mostly off of your symptoms. And if we have relieved your hot flashes, if not, then we might need to increase your estrogen. If we have increased your sex drive. So those things are just a few of the things that we can know about your symptoms and adjust your injection accordingly. There are many ways to get hormone replacement. There's oral types of medications, there's creams, there's pellets, and then there's injections. All of these are available, and we can discuss them to see which one fits you perfectly. Um, Oral medications we typically stay away from because they do go through the liver and give a second pass effect. So we typically try and stay away from those with estrogen and testosterone. Creams are also available, but the bioavailability and how your body absorbs them is also very different. It does take a longer time for creams to get into your system, and so it can be a longer period of time before you see any symptom relief. Pellets are also something that are available. The bad downside to pellets is once they're in, you can't take them out. So 3 months, you are pretty much set with what your pellet dosage is. That's why we prefer injections. The injections can be altered every month. We can also do boosters if you feel like you're not getting quite enough during the middle of the month. That's also something available. So the injections are just much more flexible, much more user friendly, and much easier to dose for each patient. Right. So cancer risk are one of the main things that people are concerned about with hormones in general. And so bioidentical hormones, again, they are the exact same chemical structure as what our bodies already make. And so they are not going to cause a cancer. Cancers are caused by things that damage your DNA. So things like some chemicals, some drugs, sometimes trauma. Those are things that actually damage the DNA, and that's what causes a cancer. So, bioidentical hormones, being the exact structure of what your body already has, are not going to cause a cancer. Now, the caveat to that we always tell our patients is these bioidentical hormones can sometimes cause that cancer to grow. If you had an estrogen receptor positive breast cancer, these estrogens can make that cancer grow, but they don't cause the cancer. And so that's why it's very important to keep up with your imaging. We have everyone get some sort of breast imaging, whatever your choice is, whether mammogram, ultrasound, thermography, which we offer, which is a way to image the breast tissue without radiation. And so we are big proponents of that. So that's what's very important to understand about bioidentical hormones. They are not going to cause a cancer. So at Hormones by Design, we go about things a little bit differently. You will already have had your blood drawn, either coming into our office or to a lab that is convenient for you, so that your provider will already have that information. And so she will be able to look at your lab work and then discuss your symptoms, your history, the things that are important that are affecting you, and go over your lab work. And so actually from that day, if you're in our office, you get an injection right then. If it's a telemed conference, then you come into the office and the lab staff knows what injection to give you, and you would get it then. Our Hormone Direct will send the injections to you. So there are many different ways to go about that, but our goal is to have you feel better from day one. So we as women, when we age, are pretty much told that all of the symptoms of going into perimenopause and menopause are normal, that you should be just fine, just figure out how to deal with it. And so many of those symptoms are weight gain and typically fatigue and lack of sexual interest. And so those are the main ones that we're pretty much told, well, that's just life, and you're going to have to, figure that out for yourself. And so that is absolutely untrue. Those symptoms can definitely be alleviated. And your hormones are typically what that cause is, because they start to decrease as we age. Your ovaries will only make so much hormone and then they stop. So that's when we can come in and help alleviate those symptoms that you have, because it is not normal. So most women think that bioidentical hormone replacement is only if you have severe symptoms like hot flashes that affect your daily living or that type of thing. And that's not true. We have many women who are in their early 40s who have a decrease in testosterone, and their fatigue level is such that they have trouble with their daily living. So there are many things that hormones will benefit that you actually have no idea that they're helping with. Your bones is the number one thing, and your heart health. They also help with foggy thinking, brain fog, that you feel like I just can't remember anything anymore. Your hormones will also help with that. So there are many things that we don't actually attribute to menopause that your bioidentical hormones will help with relief. So there are some women who feel that they just should not uh, have anything to do with their hormones, that it's just their natural way of aging, or they've spoken with one of their physicians, whether it's their PCP or their gynecologist, who really has not offered them any help. We hear that all the time. And it's something that we really like to address as education with our patients, whether they're male or female. But usually it's the women that have the most trouble with actually getting into a hormone replacement program. And so my main thing that we like to address with them is that aging is a natural process and we want to age well. And so having hormone replacement is going to help you do that. And it is a natural thing to be able to replace your hormones. You replace insulin when you're a diabetic, when you run out of insulin and your body's not making it anymore. You replace thyroid when your thyroid decides that it's going to stop working. Hormone replacement using estrogen, progesterone, and testosterone is exactly the same thing. So if you're diabetic, you're certainly going to take insulin. So if you're menopausal and your hormones are going to help your body, whether it be your bones, your heart, your brain, or your hot flashes, it is the right thing to do. Yeah, one of the things that makes me the most angry is when a physician will tell a woman, You just have to live with it. This is your life from now on for basically the next half of your life, since we all age longer now, into our 80s and 90s. My mother's 91, and perfectly healthy. So for the next 40 years, you're just going to have to live with it. That is not true. That is a mistake, and it's a fallacy. And unfortunately, women are told that on a daily basis. And so we're here to tell you that you do not have to put up with those symptoms. It is not right. And please address those issues so that we can have healthy aging. That is the primary goal. So our primary patient base is usually women, but when women feel so much better, they want to bring their partners along, and so we do end up seeing quite a few men as a response to that. Men typically have the main symptom of, I just don't care anymore. They would rather watch golf on TV than get up and go play golf. Their lack of interest in everything declines. And so, hormone replacement for men is strictly testosterone. That is the primary hormone that men make, which is different than women. We have three hormones. But men with hormone replacement is typically just testosterone, and they have a huge range. Women have a little tiny range. Women need testosterone once a month. Men need testosterone once a week. And so the range for men can be from 300 to 1200. So finding out in there where he feels the best is one of the things that is important to us, so that his quality of life also improves along with his partners, and they can go through their healthy aging together. With men, the range, the lab value range for testosterone is quite large. And so we have men a lot of times that come in on the lower level. They may be normal. It may, if the range is 300 to 1200 and they're at 374, well, then most physicians would be like, you're normal. But they're not normal. They don't feel normal. And so, again, we at Hormones by Design are not looking for a specific lab value. We use lab values to help us in treating symptomatology. So if you are not feeling great at 375, well, then we'll do hormone replacement and see how you feel at 800. It may be that 800 is perfect for one man, but another man it's not. So doing the hormone labs will give us a judgment of how we want to dose, but the symptoms are the most important thing. The response from men to the treatment is typically that they just feel more energetic. They now have the desire to go out and walk in the evenings with their partner. They now want to go play golf, and that is also the biggest thing that we see from their spouses or their partners, is that they now are interested in life again, really is what it amounts to. Sex drive also increases, and that is a big part of any couple's relationship, obviously. And so that's a bonus as well. But really, what it comes down to, and it's from the men and their partners, is that they're just back into life. There are a few side effects with hormone replacement therapy, and we have some women that have these side effects, but the majority of women don't. So some of those side effects will be with estrogen. You might have some breast tenderness. This typically goes away after the first 2 or 3 months. There could also be some breakthrough bleeding if you still have a uterus. This can usually be addressed very quickly with the addition or increase of progesterone. The other thing, of course, is that we want you to keep up with your breast imaging in whichever modality you choose to do that. But for the most part, there are no severe symptoms with hormone replacement. You just feel significantly better. There are many studies that show that bioidentical hormone replacement is very advantageous. The majority of these studies are actually with heart health. And so estrogen has been shown to benefit your heart, and as far as making it stronger and decreasing any of the bad side effects that could come along with aging, estrogen has been shown to help and increase that. So heart health is one of the number one things. Also, there's much research being done in dementia and how estrogen replacement can help with dementia. The majority of osteoporosis is caused typically by a decrease in testosterone, which is why men don't get osteoporosis until later in life when they actually have what we call andropause, where they have a decrease in testosterone. But women will start to get osteoporosis as soon as menopause hits. Same actually with heart attacks. Women do not get heart attacks until menopause, which is caused by a decrease in their hormones. So osteoporosis, typically with testosterone replacement, will improve. So these are many of the side effects that we don't actually see with menopause that we feel that hormone replacement is very beneficial for. Well, there's actually a couple of things that I hope that people glean from this masterclass. One is that hormones are safe and effective. The second is that hormone replacement is not trendy. It has been around for decades, and it is becoming more in the forefront now because there are many celebrities that are now going through menopause, and so they are they have symptoms and they're seeking relief. And so a lot of women now feel like hormones are just a trend. I shouldn't do that because, Gwyneth Paltrow does it. I should just, go on and muddle through. And what I would like for people to understand is that hormones have actually been around for decades and decades. Hormone replacement is not new. And so the most important thing is that you find a provider that you feel comfortable with, that you feel like you can talk to about your symptoms, and that they will listen. So I'd like to thank you for watching this masterclass here at Hormones by Design. We're very excited to be able to increase the education for bioidentical hormone replacement, and we'd love to see you at one of our clinics.